educate yourself on what you may be utilizing now, especially if you still have pain after many years. Your body should have had the ability to heal it. So you really have to ask yourself why it hasn't, like what's perpetuating this pain.
You are listening to The Dr. Haley Show, the podcast dedicated to helping you optimize your health. Each episode, there will be an interview or a message to help you discover better health. We will be featuring health radicals on the show to bring new ideas to the table, as well as doubling down on key fundamentals to support you living your best life. Your host is no other than the founder of Haley Nutrition, Dr. Michael Haley.
This is the Dr. Haley Show podcast. I'm Dr. Michael Haley, your show host. And today's guest, Stacey Roberts. Stacey is a physical therapist and holistic registered nurse practicing in the Milwaukee area. She also does telehealth. Stacey uses functional medicine and physical therapy to help her patients achieve their optimal health goals. For over 30 years, she's been helping patients with pain reduction, hormone optimization, gut health, and weight loss, among other things. She uses high-tech treatments like Softwave or Shockwave therapy, which is what we'll be discussing today. She's a published author. Her upcoming book, The Pain-Free Formula, will help you find relief from pain without surgery or drugs. Stacey Roberts is a musculoskeletal specialist, pelvic and sexual health physical therapist, and functional medicine specialist. You can find out more about Stacey on her clinic website, newuhealthandwellness.com. Stacey, welcome to the Dr. Haley Show podcast. I was kind of thinking of what direction we would go in this discussion because you have so many areas of expertise, which I love, from the skin health and the gut health and the weight loss. And you talked about, pelvic wellness and sexual health and physical therapy from pain, anywhere from neck and back pain and all of these things. I really only have one question prepared for this podcast, and then we'll see what direction it goes. Because I myself, I help people get well. And the reason I do what I do, really, it's a little selfish. I love what I do because of the feedback I get from my patients, customers. It just kind of really gets me charged up because it's kind of like, Dr. Haley, you're the only person that could help me with this. I'm wondering, out of all of the areas of your expertise, what brings you the most joy and satisfaction in what you do?
Well, thanks so much, Dr. Haley, for having me on the show. I really appreciate it. And what a great question. I guess the best way to answer that is to say, anything that, like you, when my patients get better or they have significant improvement, like I'll give you an example. I had a patient who had pelvic health issues called vaginismus, so fear of intercourse due to significant pain, or dyspareunia, pain with intercourse. And we saw her, and a typical physical therapy plan of care for that could be anywhere from 12 treatments up to 20 treatments. You have to go very slow because the patient is afraid, because of previous either trauma or pain or things like that. But when we utilize Softwave technology along with pelvic health physical therapy, we were able to get her feeling better in 4 treatments versus 12 to 20.
Oh, wow.
And I reached out to her at about a year and a half. I called her, and her husband picked up the phone, and I had never met him before. And it's unusual these days that somebody else picks up somebody's phone. And he said, I saw that it was your name on there, and I, just wanted to talk to you. And I was like, I haven't talked to the patient yet. I don't know how she's doing. And he goes, I just wanted to say thank you. Thank you for giving me my wife back. And I was, choked up, and I still get choked up even talking about it, because, to be able to have that intimacy again in a relationship, and, it goes far beyond what we do in the clinic of how it impacts people's lives. So when I get feedback like that, whether it's for intimacy or, a patient's able to pick up their grandchild, or they're able to play pickleball and socialize with their friends, all that stuff just really keeps me going.
I'm kind of chuckling with the one thing you said because I recently joined the pickleball cult.
Yeah, that's
Yourself?
funny. Yeah. Oh, and I've watched and I've played a little bit, but I haven't dove into like any leagues or anything yet. I'm busy in the clinic right now, but I'm sure that's coming because a lot of my friends are into it.
Yeah, that's great. I left early last night to play right after work, so I'm a junkie.
It sounds
So
like it.
let's talk about the pelvic health and sexual health area then. And I also like the fact that you called it intimacy, which to me is so much bigger and more important. And not that you have to have sex to have intimacy,
Mhm.
but that's one of those components that's very dear and important to people. You mentioned the shockwave therapy only taking like 4 treatments. What other kind of treatments would they have had to go through that would have taken 12 treatments? And we'll talk about what shockwave is in a moment.
Sure. So traditional pelvic health physical therapy, where they would do internal treatments and external treatments, really, and a lot of breathing exercises, manual therapy. We look at the pelvis and the low back and the hips, see what potentially could be contributing. We help with stress management. All those things were still in those 4 visits that the person had, but when we added Softwave to it, which is a type of shockwave, it just accelerates the healing. It accelerated the ability for me to do internal work that would have been excruciating or even off limits for a period of time. So I was able to do that work without the pain that the patient would typically experience. So it was more effective because it was more comfortable for the patient. And just the effects of shockwave therapy help to accelerate the healing process. In this case, many times the pelvic floor is what we call upregulated. So lots of tension or tone in the pelvic floor. And what happens as a result of that is there's decreased blood flow to those muscles. If I kept my biceps in a contracted position all day long, it wouldn't have the blood flow coming and going like it would normally. So that can be what's called an ischemic muscle where it's lacking blood flow. So Softwave significantly increases that blood flow immediately with treatment, so that I was able to do internal work on the first treatment that, like I said, sometimes doesn't happen for weeks when you're doing just traditional pelvic health physical therapy. So it really moved everything along for the patient.
Yeah, and if I'm summarizing what I think I'm hearing, um, internal treatment would be potentially painful, kind of like penetration, which is why they're avoiding intercourse. And if I'm
Mhm.
understanding correctly, you're able to do that because of starting with an external treatment with shockwave.
Yep, our treatment with Shockwave is external. So thank you for bringing that up. We just set it right on the perineum, which is between the vagina and the anus, and just aim towards that pelvic floor. And it usually is completely painless. There may be a couple trigger points in the pelvic floor where the patient might feel a deep ache or like a deep massage to that area. And if it would ever become too painful, it can be turned down so that we want that patient to be comfortable because we want the blood flow to go there. We don't want them to be afraid and contracting because that pushes away the blood flow.
Okay. Um, right off the bat, for the listener, I want to open up their mind to the other areas that this might be applicable, meaning we seem to be focused already on women, vaginal tightness type pain. What else is this used for?
So it can be used for any musculoskeletal issue, and specifically for men, it can be used for ED. So I have a portion of my clinic where men come for ED treatment, where we use our Softwave device again, which is the type of shockwave. But it's really important for men and women to understand that not every device is the same. You can go to Amazon and buy something that's kind of like a muscle massager, and they call it, shockwave, or you could go to a clinic and get, Softwave with a pelvic health physical therapy, plus treating the, lumbosacral spine where the nerves come out of to innervate the genitals. And those things are something that you just can't do with a cheaper version of a device that doesn't even produce a shockwave.
Mhm.
Besides sexual and pelvic health, we can do pelvic pain in addition. But besides pelvic, and sexual health, we can treat pretty much any joint in the body with it that is painful or inflamed. And again, we get a lot of significant acceleration of healing as a result. It helps to heal scars, or it helps decrease pain with painful scars. It's really left up to the clinician's imagination, because it treats musculoskeletal issues. So any of those, shoulder tendonitis, frozen shoulder, knee pain, arthritis, hip pain, back pain, you name it. Pretty much any body part can be treated with it.
Okay. We're going to get into the how it works, and I think this question is going to bring us right there, because, and for the question, we'll focus on intimacy and that type of pain, because in treating pain, there might be a fear, if I treat the sensory nerves and decrease sensation, is that what I'm doing when I'm eliminating pain, and then intimacy wouldn't be as pleasurable? Or what's the
No,
mechanism?
it's the exact opposite. Because we're bringing blood flow to the area, we can make the nerves more sensitive. So, for example, recently in our protocol with ED, I helped the company whose device I use, Softwave, I helped them create and expand their protocols. And recently we started treating the pudendal nerve, which comes out of the sacrum, runs into the butt, dives down towards the sit bones with ischial tuberosity, and then branches out and innervates the genitals, both male and female. So by treating that area, by bringing more blood flow to that area, we're actually increasing blood flow and sensation through that nerve to the genitals. So it significantly increases not just blood flow to the penis by treating the penis with Shockwave, but also increases the innervation or sensation to the genitals for, again, either the male or female. So it actually improves that intimacy due to improving sensitivity.
Interesting.
Good sensitivity, right? Not like painful sensitivity.
Yeah, that's great. Do you have the instrument for those that are seeing this on YouTube?
I don't have it with me today, but I can certainly give you that for the show notes to put in there, and even like a video if you'd like.
We can probably edit in a photo of it, but could you describe it?
Sure. Softwave is an electrohydraulic, broad-focused shockwave device. So there's several different shockwave devices out there. Most of the shockwave devices, if they're true shockwave, the energy comes out like a laser. But this one comes out like a flashlight. So we're getting that focal point in the middle, like the other ones do, but we're also treating the area around the area that is sore, or the area that we want to increase blood flow to. That again results in the patient being a bit more comfortable as a result. And the mechanism of action is increasing blood flow to the area, modulating inflammation. So if the inflammation is too high, it brings it down. If the area needs to be stimulated, or it needs to improve that sensation like we talked about, it can help do that. With scars, it can help with pain and also smoothing out the scar. The scar tissue, it revascularizes, brings blood flow to that scar tissue to make it less painful. And new research is showing that it's actually changing the type of cell in the scar tissue. So it's a modality that me, as a physical therapist over 34 years, has never seen the acceleration of healing. And as a matter of fact, I was extremely skeptical about it. So much so that 4.5, 5 years ago, when my friend brought this to me and said, "Hey, have you ever heard of this?" I'm like, "No, I'm sure it's not going to work, because I've been in this business for a while and I've never heard of it. And, look at that thing. It looks just like a space age ultrasound. It's not going to do anything different." So she promised me a free lunch. So I went to a treatment with her, and I had treated her for a shoulder in the past, and she was fine. But at the end of the range, if she'd sleep on her arm wrong, she would have pain, and she wanted to get rid of that. So I said, "Okay, well, I'll go with you to make sure at least it's safe. Plus, you're going to take me out to lunch after." So we go, and the person does the treatment, and she raises her arm up and she goes, "Oh my God, the pain's gone." And I'm like, "Okay, talk to me in like 2 or 3 days. I'm sure it's going to be back." And really, it took 2.5 years for her to need another treatment because of pickleball. She went and played pickleball and messed her shoulder up a bit, and then came back to me for more treatment with Softwave. But unless I had seen it myself, I wouldn't have believed it. And then for me, I'm a big skeptic. So then I had to dive deep into the research. and it was during the beginning of COVID, so that allowed me the time to do it. And now I teach courses about it, and 90% of my patients get that treatment because it's so effective.
You enjoying the show thus far? One of the many health secrets that we have covered on the show is all around aloe vera, specifically drinking raw aloe vera. Our aloe vera has helped our customers effectively heal their gut, increase their intestine health, lower inflammation in the body, eliminate and/or decrease acid reflux, have glowing skin and hair, and so much more. Now, as a frequent member of our audience, you will be exposed to exclusive specials and coupon codes for the awesome products manufactured by Haley Nutrition. That's right, for simply being awesome and tuning in, you can get a mini discount to help you optimize and better your health. To see how we can help and support you on your health journey, tune into the episodes and listen for coupon codes that you can use at www.haleynutrition.com before you make your orders of raw aloe vera. Once again, it's www.haleynutrition.com. Now, back to the show.
I truly appreciate the skepticism too. To me, when you start looking into something with that, and then you find out, wow, this is real, it's all the more real. It's not the placebo effect.
Right.
You kind of eliminate that with your skepticism. So
exactly.
Love it. I'm unclear on the technology though, meaning, we have like ultrasound uses sound waves, and there's red light therapy uses light, and there's, percussive waves and different kinds of energy. What is this using?
So it's using shockwave. So basically what happens, like when you have an explosion, there's, a wave that comes off as a result. That's called a shockwave.
Not a vibration.
So, not a vibration, it's just a wave. So if a volcanic eruption, for example, comes up, and there's a huge shock wave that comes out as a result. That is
not electric shock.
Correct. It's a result of, in this particular device, it's a result of a spark. So it has like an electrode inside the device, which when it clicks, there's a little spark that's created. So I guess you could say it comes from that electrical spark, which is like a mini explosion. And then the wave comes out of there. Now, because it's electrohydraulic, it's traveling through water. So that makes it travel 5 times faster than through air. So it has a big push behind it. And it originally was used for lithotripsy, or breaking up kidney stones. And that's why they took that, that energy, like a volcanic eruption that kind of comes out like a flashlight, or an explosion that kind of goes out wide. And they made it into a pinpoint area. They focused all of that energy into one area so they could break up the kidney stones. So once it enters the body, it turns into an acoustic wave, but it's much more pointed and powerful and high energy to break up those kidney stones. But the interesting thing they saw was the vertebral bodies behind the kidneys or to the side of the kidneys were starting to become more dense. So they knew that it was able to increase the density of bone. So they wondered what it could do on fractures that weren't healing. Lo and behold, when they started treating the fractures with it that weren't healing, it accelerated the healing process of those fractures. But both of those procedures needed to be under anesthetic because it would have been so painful. Oh. So then they brought it down to low energy. But all of the devices except for the one I have still came out like a laser, whereas the one I have more comes out like that flashlight. So that wave, that shock wave that's traveling through the water, once it hits the body, turns into an acoustic wave, but it can get much deeper than ultrasound. And in particular, it can, and even in some comparison to some lasers, can get deeper, and definitely deeper than the red light. But as far as the therapeutic effect goes. So we're hitting that area that's, again, wider and deeper than the other devices. And frankly, I mean, I've seen modality after modality, prior to this that did pretty much nothing. Or again, I could use it in conjunction to my physical therapy, but it didn't accelerate the process. It would be about the same number of treatments. Whereas this is really moving the needle for patients because it accelerates their progress so quickly.
Is the procedure similar to ultrasound or red light therapy? Or
it's similar in that the therapist is applying the technique, applying the applicator to the skin, but very different experience. So for example, in our device, you'll hear it clicking and you'll feel tapping on the skin. And then, but you only feel tapping on skin that's not irritated or inflamed, or over an area where tissue underneath the skin is irritated or inflamed. Once we get over that area, the patient goes, oh, wait a minute, now I can feel that. So it's either they say it's like a pinch or poke or like a deep ache or a deep massage. It doesn't have to hurt a lot. Sometimes I see people turn it up and patients are like wriggling around and it hurts. And that doesn't have to happen. My patients experience, out of 10, if 10 is the worst pain you've ever experienced, they might, experience a 4. And then during that treatment, 4 or 5, during that treatment time, the pain actually goes down. So they're 50 to 100% better when they stand up afterwards.
Oh, wow.
That will last. Yeah, that will last for a few hours up to a few days for the first treatment. And then with each treatment, they should be getting subsequently better for longer.
Is that 50% better just from the shockwave or after the internal work that you do following the shockwave?
50% better just from the shockwave, and then even up to that 100% better in conjunction with the physical therapy and manual therapy that we do.
Wow. That's impressive.
Yeah, again, if I was on the other side and you were telling me this, I would have been kind of rolling my eyes on the inside and going, yeah, right. So it took for me to see it and utilize it to really see the changes that it can create.
Yeah, and you mentioned it being used for kidney stones at some point, which tells me it goes pretty deep.
Correct. So depending on the device, there's a few different true shockwave devices that actually produce a shockwave. They can go anywhere from an inch deep up until potentially like the size of a soup can depth. Ours goes with the width like the soup can, and others go just like a laser pointer. So, like I said, ours Softwave is more comfortable, and I feel more effective. I've tried all the devices prior to landing with Softwave.
And the difference between Softwave and Shockwave?
Softwave is the name of the company. Shockwave is the technology.
I got you. And when was this technology made available for treatments like this?
Softwave has been around for 20 years with Shockwave, and it's been variable, kind of morphed into more of a now either chiropractor, physical therapist, outpatient clinics. I've trained the New York Yankees, the Boston Red Sox, the LA Dodgers, New York Giants, New York Rangers. So it's now really gaining in professional sports as well too. When they're using it for both treatment and prevention, we know that it works, obviously.
Yeah. The hardest things for me as a chiropractor to treat have probably been shoulders.
Mm-hmm.
And you already gave an example of that. And also
Mm-hmm.
knees.
Mm-hmm.
What are some knee stories that you've seen?
Got a perfect one of my own knee story. So I was at a wedding about 3 years ago. I had Shockwave maybe for about a year and a half. And I'd use it occasionally on different parts of my body, but I went to a wedding and I was doing the polka with my son because I saw him do it on the dance floor, and I was like, "Oi, he's not very good at that." So he was 21 at the time, and so I wanted to teach him how to do polka. So I went out there, and I don't wear big heels at all. I might have had a little wedge heel, and we're doing the polka, and all of a sudden a big pop in my knee, and it was the knee that I had ACL repair, probably 1986. So let's just say almost 40 years prior. And it swelled up like a balloon. It felt like somebody took a knife and was jabbing it on the inside of my knee. I could barely walk. So I, dragged myself off the dance floor. It blew up like a balloon. I dragged myself back to my car, leave the wedding early, and piling ice on it. Had to drive home. Thankfully, my son was with me because it's my right knee, so couldn't drive. I immediately put Softwave on it. And I actually have video on this too. I could barely put weight on it. And then after the first treatment, I could put some weight on it. By the third treatment, I was off crutches completely. And that wouldn't have happened that quickly. But here's the interesting thing. As a physical therapist, I wanted to know what that pop was, right? So I was like, what was that? Is something like the screw break, because I have a couple screws in that knee. So I went to a doctor and had an MRI, had an x-ray, finally met with the doctor and sat down with her. And she said, and I was like, well, what was the pop, do you think, after looking at this? Because I couldn't see anything. on the MRI or the X-ray, and she said, "It doesn't really matter. Your knee's full of arthritis. You need a knee replacement." And I was like, "Well, wait a minute. I haven't had any, I haven't had any pain prior to this." She's like, "Well, see, your knee's full of arthritis." I'm like, "I can see that, but if I don't have pain, I don't care how much arthritis is in my knee, right?" So the point with that was my patients think that arthritis always has to hurt, and it doesn't. We
Right.
can get the inflammation down to a point where, yes, there's arthritis. I'm not saying that my knee suddenly doesn't have arthritis in it, but again, I don't have pain that's associated with it, so I can be as active as I want. So I have been to a few weddings since, pain-free and injury-free. Although I do have to say that they're dangerous places for 50-plus-year-olds, because every wedding I've been to so far, I've at least got one patient out of because they've hurt themselves while dancing on the dance floor.
Yeah. And did you say you have you already ruptured your anterior cruciate ligament in the
Yeah,
past? Had that
I had that
repaired?
surgically repaired in college basketball. Yep.
Yeah, and I would have thought the pop was a new rupture, and that's probably what you were concerned about.
Exactly. Where it was, I didn't think it was the ACL. I thought it was more of the medial collateral ligament and the medial meniscus. But looking back at it now and still kind of where it hurt, probably was some old scar tissue that just popped, but was also that scar tissue that had been also supporting my knee in some way, shape, or form at that time. So the MCL did show a sprain, but my meniscus are pretty much trashed. But again, it doesn't bother me because I don't have any pain with it.
Wow, interesting. I think I heard also that Shockwave was used for skin conditions as well.
Can be. So wounds, especially, Softwave in particular, has a clearance by the FDA for treating diabetic foot ulcers. So it can help to not only accelerate the blood flow to the wound to help with healing, but it breaks the biofilm up of the bacteria. So if they're resistant to antibiotics, Shockwave can break open that bacteria and then allow the body to do what it's supposed to do in getting rid of that bacteria. So you see significant wound healing. I had a patient with a wound about the size of a $50 on his big toe, and he was going to have that amputated. He also had osteomyelitis in that same toe, which is a bone infection. And they had done 6 months of antibiotics, nothing worked. And we thought, well, let's give it a shot. The next step is amputation. It completely cleared up. The osteomyelitis went away. And we saw new blood flow, new vascularization coming from his hip, his inner thigh. I was treating his toe. So the body was trying to grow new blood vessels down to that area to be able to give it a new blood supply. It was amazing. So he didn't have to have that toe amputated, which was fantastic. But skin also, you have burns, lacerations, things like that. Really, really beneficial and very versatile tool.
What about scars from tummy tucks to C-sections? And
You bet. We're starting a pilot study right now. There is just general information about painful scars, but we want to be very specific about C-section scars because they can often be real painful, even years after. When I was training a physical therapist how to use the device, she had a person who had a 3-year-old C-section scar that was still painful and causing her a lot of issues, a patient who had this. And as we were doing Softwave, suddenly the patient sat up when we hit a certain area of her scar, and I was like, "Oh, was that painful?" She's like, her eyes welled up with tears, and she's like, "No one's been able to find that spot in 3 years." And she's crying, I'm crying, we're all kind of crying. And by the end of the treatment, the pain was gone. And then by the end of 3 treatments, it was completely resolved, which again is extraordinary, So pretty much for any of these musculoskeletal and scarring things, I've had some tremendous stories of how it can help.
yeah, you mentioned the nerve. I forget which one it was that the men and women off the pelvic coming from the sacral area. Which nerve was that?
Pudendal nerve.
Pudendal. If you were treating a male that had an issue there, do they have to be concerned about, say, prostatitis or increasing inflammation?
So if you do it too high, and that's why you need to go to a practitioner that knows what they're doing. If you do it too high, you can flare it up. So what's happening is it's moving the patient from a pro-inflammatory phase to an anti-inflammatory phase so that we can support the healing process, right? So then the body will heal. if the energy is too high and too long on one place, you can really upregulate that pro-inflammatory response, and that patient can be sore for a long period of time. So you want to make sure that you're seeing somebody who's, now again, that's not necessarily a bad thing from a standpoint of healing, but it really stinks when the patient is extremely sore for, weeks or, days after. So when we're treating, we're looking to shift it from that pro-inflammatory sore phase to the anti-inflammatory phase where they're not really feeling significant pain, and then the body can go ahead and heal. So we always get a shift from, let's say, that subjective complaint. Somebody tells me that feels like it's about a 4 to 5 out of 10. We look during the treatment to get that pain down to a 0 to 2 out of 10, which significantly reduces the chance of them having a flare. So as long as you go to a person who knows what they're doing, knows the anatomy in the area, there's really no risk of having any sort of significant injury by any means.
What are the contraindications?
So 3 absolute contraindications across Shockwave is not over a pacemaker, not over a pregnant uterus, and not over a malignant tumor. There are some studies on tumors in hospice patients where Shockwave has been applied to those tumors, and those tumors have shrunk. And there's some ongoing research on utilizing Shockwave with cancer in Europe, but it is completely off-label, and it's still an absolute contraindication.
Yeah, and it sounds like, I'm not saying this, but it sounds to me like everything, there's a contraindication, cancer, it's one of those unknown areas. So for that reason, because it's cancer, we're not going to mess with it. So it's a contraindication, but it actually might be just the opposite.
Right. And because we're always worried about if we bring more blood flow to an area that has cancer, is that going to feed the cancer and allow it to grow more quickly? But because Shockwave is upregulating the immune system, what they're finding in the very preliminary studies is that upregulation of the immune system helps the body address that tumor. Now, again, it's very, very new, and there needs to be many, many more people or animals studied in order to lift that contraindication. But in no way, shape, or form would I recommend it at this point to treat any type of tumor.
Yeah. Well, that makes sense. As a thank you for being a fan of the Dr. Haley Show podcast, throughout March of 2025, enjoy 10% off your entire purchase at HaleyNutrition.com. The coupon code is HOPEFUL, HOPEFUL, because we are hopeful to have aloe vera back in stock before the month is over. In the meantime, we thank you for your patronage of our other products. Consider combining this coupon with our already discounted and on sale bundled products, and enjoy the rest of this podcast. I'm in the aloe vera business, so the picture behind me is an aloe vera field.
Awesome.
It's interesting because it's reminding me of some of the things that aloe vera does as far as like increasing blood flow and upregulating the immune system in the sense of increasing tumor necrosis factor and interferons and interleukins and things that help fight cancers. Mm-hmm. Although it's not a cure for cancer, it's something that can help. And I can't wait till there's more research on aloe vera in cancer, and it sounds like Shockwave too. So need the research.
Because doesn't aloe vera also help with the mucosal membranes as well too?
It does a lot, but I'm not sure of the necessary mechanism. In other words, is it because it increases blood flow? Mm-hmm. And it helps in that way? Is it because it upregulates the immune system?
Right.
Ingesting it helps you absorb your nutrients better. There's so many mechanisms that it can, help with the various things. The increased blood flow, maybe that's why it promotes healing when you ingest it. I don't know.
Right. Interesting.
Yeah. Shockwave, how much does it cost? Does insurance cover it?
So insurance, there are CPT codes for it, and insurance at this time does not cover it, except in some areas and some MACs. Medicare is getting reimbursed for ED treatment. However, and there are a few places that also you could get reimbursement for wound treatment. But because there's so many different devices and so many different protocols, and some of the devices are not getting the best outcomes, like our Softwave device gets some great outcomes, it's a perfect reason for insurance to say, no, we're not going to cover it because there's inconsistency across the board. So for right now, the majority is not covered. But what patients are finding is because it's decreasing the amount of time that they would have to spend in physical therapy or chiropractic or whatever anyway, it's really can be more economical and save money. And in some cases, my patients will take their super bills that we provide, and if they have an out-of-network provider, they put that against their deductible. So there are possibilities that it can be that the cost be used for HSA, FSA, those types of things as well too.
That would make sense, especially if there's CPT codes, which,
Mm-hmm.
getting the coding is a huge process that takes years. I wonder how long they've
Yes.
had those codes.
The musculoskeletal code's been around for a while because it used to be the related to high intensity, but again, never really been paid. And Softwave is one of the pioneers who pushed through the CPT code for ED, and we're trying to do the same for women's pelvic health. And so they've really, I think it took about a year to get the ED one through, and we'll see what happens with the pelvic health. I'm doing just finished an IRB supported single. Blinded controlled study on dyspareunia with Softwave. So if we can get more of that data behind it, then there's more of a chance for it to be, number one, shown that it's safe, right? And then number two, that it's effective. So once we have that data, I'm confident that Softwave will be ahead of the game again and trying to push for more CPT codes for that.
Yeah. I would imagine some people are probably hesitant to open up with their challenges in the area of sexual health.
It can be. I mean, it's much, much better than it was, say, 10 years ago, and even better than 5 years ago, right? So more people are understanding that something can be done, but there's still people going to physicians who are like, oh, it's because you're aging, or, oh, that's normal. Well, the pelvic pain, sexual dysfunction may be common, but it's not necessarily normal, right? So we really have to have medical professionals educating patients about, hey, there are these other options. But to your point, it's still difficult in our society to talk about those things in general. So what I find is patients who come in to see me for musculoskeletal issues, we have a question on there whether they're having any pelvic health or sexual health issues. And sometimes they put it on there, sometimes they don't. But after they, develop a rapport with myself or my colleagues that are working with me, then they can open up about those things, right? Or they see that we have brochures about it, and they might bring a brochure in and be like, hey, I see you do this stuff. So sometimes it just takes a little bit of that building of that rapport, but it can be uncomfortable to bring it up. But we do our best to make it as comfortable as possible to talk about it in the clinic.
I'm laughing because I'm thinking about a patient that I had probably 30 years ago.
Mm-hmm.
And I have the questions on my form too. Are you having any challenges in this area?
Mm-hmm.
And, the answer was no. But he
Mm-hmm.
had back pain going down his leg and neck pain going down his arm.
Mm-hmm.
And in his case, I adjusted him incredibly. I mean, it sounded like
Mm-hmm.
sitting on a bag of potato chips when the bones all moved and everything. And in that case, we released a nerve pressure. And I'll never
Wow.
forget him the next day saying, Dr. Haley, something you did. And I said, what's going on? He said, well, I don't have any neck pain going down my arm. I don't have any back pain going down my leg. Something you did. I said,
Mm-hmm.
well, what's going on? And he, kind of leaned in and he said, I can have sex again. I said, yeah, on the form, you didn't, check
Yeah.
that. I didn't know it had
Mm-hmm.
anything to do. How long you been having that problem? 10 years.
Wow. Yeah.
He was willing to go 10 years without addressing the issue,
Mm-hmm.
probably out of fear, discomfort, or whatever it was. And it was a simple fix.
Right.
And,
Yeah.
and
It is. It's education wise, they don't know that you can do anything about it, except especially if they don't want to take medications, or maybe the medications don't work for them. So it's, again, there's a stigma in our society. So the best thing I feel we can do as practitioners is just leave that door open, right? Let them know that it's okay to talk about things that are a little bit more uncomfortable, right? And in my clinic, we have more time. I spend, 30, 45, 60 minutes with patients. So we can sit down and talk about those things and develop that rapport so that they feel comfortable speaking up about it or even asking the question.
And you're still doing the telehealth, right?
Yep, I'll
That
do telehealth as well.
that would probably be an easy way for someone to discuss it.
Right, exactly. And with telehealth, we kind of go through what the patient can do at home to improve their situation, and then if they still feel they need softwave therapy, then we help them find somebody in their area.
That's great. Now, I did take a peek on your website, which was newuhealthandwellness.com. It looks
Mm-hmm.
like you have a pretty happening clinic there with other healthcare practitioners working with
Mm-hmm.
you.
Mm-hmm.
And I saw
That's
a huge variety of areas that you address.
mm-hmm.
Tell me a little bit about your clinic.
So the clinic, we have another physical therapist. We're hiring another one now. We have an exercise physiologist, personal trainer, and then myself. And then we are expanding to a nurse practitioner this year as well. And we really look at the whole person. So if you're coming to me for an issue with your joints, then we talk about what you can do with your biomechanics and Softwave therapy. But if that's not improving, then we have our functional medicine program, because pain can come from being in perimenopause or menopause. So pain can come from hormone issues for men or for women. So for men, I have this guy who's 35 years old, and he had bilateral hamstring pain right at the insertion on the sit bones. And he was told over and over, there's inflammation there. They couldn't give him a reason why. And I said, I think we need to look at your hormones, because Softwave was working a little bit, but then it would come back. And he's like, oh no, I'm 34. He doesn't have any sexual issues. Well, sure enough, because he was just frustrated, he asked the doctor for testosterone tests, and he got those done. His testosterone at 34 was significantly low. So we needed to work with him on naturally improving his testosterone production in order to fix the musculoskeletal issue. So that's why we do that, where we look at the biomechanics and that first, localized inflammation first, and then move on to the functional medicine if it's a systemic issue. So people that come to see me for functional medicine or for menopause or perimenopause, if they might have joint pain, because what women don't realize is that the more popular symptoms like vaginal dryness and hot flashes are just as common, or joint pain can be even more common in menopause than those that we hear about all the time. So again, it could be an issue where they just need some localized treatment on that area, or again, more of a systemic treatment where we look at hormones, we look at gut health, we look at food sensitivities, all those types of things that could be contributing to pain that's not resolving or hasn't resolved for a period of time.
I think that's great. And especially, when you look at things like hormones and gut health and,
Mm-hmm.
how it all works together, you
Yep.
can be tunnel vision and say, okay, you need this therapy here, and I'm not going to look at those other things. Let's just try this
Mm-hmm.
therapy.
Mm-hmm.
But you never really get to the root of the health challenge, the overall person, without looking at the diet and the gut health.
Exactly.
And
Yep. And that's exactly what my point is of the pain-free formula, is to look at, number one, how is conventional medicine dealing with pain now, and why people aren't getting better just with that model, and then what they can do instead. So we talk about biomechanics, we talk about Softwave, but we also talk about hormones and gut health and food sensitivities and even stress,
yeah,
and how stress can impact our pain too.
yeah, I can treat your skin conditions, but if I don't address your gut, we're probably going to be treating your skin conditions forever.
For a long time. Yeah. And that's unfortunately how dermatology and the medical conventional model, what it's based on,
Yeah.
basically.
And you are practicing functional medicine.
Hmm.
Why don't you tell
Correct.
us a little bit about how that's different from the medical approach?
So just exactly what you said a few minutes ago is it's looking for that root cause. So the root cause of something could be inflammation, but then we're looking at the root cause of inflammation, right? So conventional medicine or creams and topicals and all that stuff treats the inflammation, But if you don't get to the trigger of what's causing the inflammation, then just like you said, it's most likely going to come back. So we want to get to that underlying cause or the root of the root, and really address that specifically. And it may be a couple things. It might be optimizing hormones and then doing that through working on the gut, right? It might be, through working on the strength in your hip to help your knee, but also looking at food sensitivities that might be contributing to joint pain. So it could be a combination of different things also. And that's why the functional medicine aspect of it just again really is diving down to the root cause of the inflammation to figure out, why hasn't it gone away yet?
Yeah. Stacey, you're brilliant. You have a lot of information. And if I want more of your information and I want to learn from you, I understand you have a podcast that is up and coming.
Absolutely. By the end of March of 2025, we'll have the Pain-Free podcast, or Pain-Free Formula podcast, coming out to all the popular podcast channels. I'm launching with just some general information about inflammation and how to address pain. And then I'll be doing interviews, like hopefully with you, Dr. Haley, for different topics. And really, we're going to expand not just for muscle and joint pain, but emotional. I'm having a psychologist come on to talk about how to deal with chronic pain or trauma or things like that. So anything that causes pain, whether it's physiological, physical, or psychological in our life, we'll be talking about on the Pain-Free Formula to help people.
Excellent. Is the best place to get in touch with you if I wanted to do telehealth? Do I go to newuhealthandwellness.com?
Yes, or you can email info at newuhealthandwellness.com, or you can give us a call at 414-299-8121, and we'll be happy to help you and see how we can serve you and help you feel better and be as active for as long as possible.
Okay. Is there anything that we didn't talk about that you really were hoping that we would?
Gosh, you got a couple more hours? No, I think we hit really all the topics about alternative ways of looking at things, which should be first line instead of totally ignored or the last thing tried. But one thing I just wanted to point out is, if conventional medicine, if pain medication has worked for you, but it's potentially causing other issues, then like NSAIDs can affect the kidneys is something that we know now, but it also can, if you're taking these for long term, it also can increase your sensitivity to pain. So even if you're taking these because you think it's helping your pain be better, it's actually making you more sensitive to it. Same with pain medications as well. So a lot of the things that may be working to kind of put a lid on your pain may still be causing you pain as they wear off and increased level of pain. So just educate yourself on what you may be utilizing now, especially if you still have pain after many years. Your body should have had the ability to heal it. So you really have to ask yourself why it hasn't, like what's perpetuating this pain, and being accountable for your own health to keep seeking answers is really important as well, as you know.
The functional medicine approach.
You got it.
Yes, if you haven't tried that, people, try that. We're not treating the symptoms. We're getting to the root of the problem, the cause of your symptoms. Stacey Roberts, thank you so much for joining me. And I know people are going to benefit tremendously from this. And I hope people that are shy about their issues or, whatever it might be, or that have been hesitant, I hope they give you a call so that you can lead them in the right direction. Thank you so much.
Thank you so much for having me. I really appreciate it. It was great.
I hope you enjoyed that episode today on The Dr. Haley Show. Make sure to hit subscribe on whichever platform you are listening to this. If this episode made you think of someone, go ahead, take a screenshot, and share this exact episode with them. You can catch the show notes for this episode on www.drhaley.com. If you want to geek out with Dr. Michael Haley on other radical health topics, be sure to check out his YouTube channel, where he posts exclusive video content. All the details are at www.drhaley.com, and we can't wait to hang out with you on the next episode.